What's up, guys? In this video, I'm going to talk to you about some interventions that you can use for your patients that have dementia. So I was recently watching this course from MedBridge that was it's called Evidence-Based Interventions for Individuals with Dementia. So she kind of goes over the evidence base and kind of the research out there that's helpful for treating dementia. And I feel like speech therapists mainly do this, but occupational therapists should also be doing this. And I feel like any discipline really in healthcare could be doing this, and that's going to be called space retrieval. So it's just what you're pretty much doing for space retrieval is you're setting up a target. So anytime they get out of bed, you want them to hit the call button or like call the nurse. And so you're going to ask the patient, you're going to use the same phrase over and over and over and over with them. So you're going to say, what are we going to do before you get out of bed? And the correct answer is going to be use the call light. And so you're going to just talk to the patient first and just say, anytime we get out of bed, we got to use the call light. What are you going to do when you get out of bed? And they're going to say, use the call light. Then you're going to wait like 15 seconds. You start it with like this short period of time. So what are we going to do when you get out of bed? And they're going to say, use the call light. 15 seconds later, what are we going to do when you get out of bed? And they're hopefully going to say, use the call light. You start with 15 seconds, you go to like 30, then you go 45, and then a minute. And you're eventually going to try to work it up to like 4 minutes or longer. You can put like paper in the room. If you can't get them to do it, just like write it on a whiteboard or piece of paper that says, hit the call button if you need to use the bathroom, right? So it's just going to be something simple like this. And the whole idea behind this is that these patients with dementia really can improve their processing and kind of retrieve that information as you continue to reiterate that over and over and over and over again with them. So that's one helpful way to kind of help your patients that are struggling with something. Maybe you want them to be able to do something on their own. Maybe they have a caregiver that's just really struggling and they don't know how to help them, or they just want them to be able to do like a simple task like ask for help before they take a shower or get dressed. You probably want to just focus on something simple at first, but that's kind of the main treatment here. And the other thing that they talk about is she calls it errorless learning. And I think this is really cool for dementia patients because you don't want to be it's kind of like a child. Like, you don't want to constantly be correcting them and telling them that they're doing it wrong. Like, if you have to use the bathroom, what are you going to do? And if they get it wrong, you don't want to be like, no, you don't like punish them. You just tell them the answer. And so with errorless learning, the whole objective here is not to get upset with them or tell them that they're wrong. You're just correcting them and giving them the correct answer. I think that's huge for dementia patients. There's so often we are correcting them or we're telling them that they're wrong. A lot of times doctors or anyone that's coming in the room is asking them orientation questions, and they may have not been oriented for like years, and we're still asking him these questions and telling him that they're wrong. No, today is not the 13th. It's February 2nd. Like, there's so many things that we do with dementia patients. It's just kind of the wrong way of going about it. And so we need to like follow this errorless learning and stop correcting them. So I'm going to talk to you about this a little bit more, but if you're interested in checking out this course, use my link OT Focus. I actually get like a little bit of kickback with that, so that would help this channel. And also Jane Yekel, that's the person you want to check out. She's the person that made this kind of lecture series. She's really good at it. MedBridge has a ton of courses on there. Not all of them are excellent, but hers, like, definitely check it out. Okay, so the next thing she talks about is it's the Montessori-based dementia program. I can't remember where it originates. The Montessori approach is when they walk into the room, there's like all these different tables, and the person with dementia can like choose what activity they want to do at the table. So it's kind of like this client-based way of helping them or like treating them, because you're doing something that they're interested in rather than like saying, this is what we're going to do for today's activity. And I mean, this is like a huge occupation based way of like helping your patients. And so I think one way we can do that in our practice is you could just have like 7 different activities that you're going to do with people that have dementia. One thing could be like fixing like a car part or something. You could have like puzzles, you could have Sudoku, you could have crossword puzzles, word searches. You could have like all these different interventions or activities just to kind of work on, and you put it on a cart, right? And so you just take this giant cart or whatever, you can just wheel it down to the patient's room, and then you can just ask the patient, like, which one of these do you want to work on? And that way it kind of gives them a choice. They can kind of decide what they want to do rather than just being like, this is what we're going to do, and good luck with that. I mean, you could have a musical instrument on here. You could have a keyboard, a piano, like just something like simple for them to kind of work on. And it doesn't have to be like an actual like OT activity you're doing. It can just be something that they're interested, like a keyboard, like a mini keyboard to play the piano, or it could be like a picture book. You could get like a Lego set and like do Legos with them. This is not going to be work for everybody. I mean, there's a lot of people that are not going to want to do Legos, but there are going to be some people that would. You could get a Lego set that's like a more mature Lego set. I know they make a ton of Legos that are for adults. They're kind of expensive, but maybe you could get your facility to like buy something. And so I think that could be like a good idea for just working with patients that are working on problem solving activities. A Lego set is going to be perfect for people like that. I mean, maybe you have a patient that was in the military or they love airplanes, and you could have them build like one of those more mature Lego like airplane set. Like there's so many options here. And so like even if you're trying to give them ideas for their caregivers, I think Legos could be like a great idea for them if they are interested in like building something or recreating something that they're actually interested in. And that's the next thing that she talks about in our course is kind of age-based learning. And so with dementia patients, further that dementia progresses, it's kind of like their age kind of goes down a little bit. And so I want to say that some of these activities are going to be more appropriate for them because they're going to be more interested in something like a Lego set or something that's just simple like coloring book. And another thing that she mentions in this course, she kind of talks about the struggle that we all have. We have tons of patients that are just sitting in a room staring at the wall. And I come by this every single day. We have like a dementia patient that's not doing anything. They don't even have the TV on. They're just staring at the wall. And she was just kind of saying like how disappointing it is to see patients that are like that. And so I've kind of taken it upon myself to just make sure that my patients with dementia are doing something. So if I can, what I do now is after I see them for therapy, I get them up in a chair, I take them to the nursing station, and I give them an activity to do. Recently, I had this patient, she hadn't done anything for like weeks, just staring at the wall, sitting in the room. I take her out, put her in the hall, and I bring a coloring book to her, give her some like crayons, and she like went to town. She was so excited. People were like complimenting her on the coloring book, and I think that's kind of what it's all about. Like if you can just give them like a compliment of some sense of accomplished for something that they did or created, that's going to mean the world to them. And I think that's huge for this population. A lot of times they're just sitting in a room kind of being like self-isolating, and they don't have any of this outside feedback. And if you can kind of provide that to them in a hospital setting by just getting them out of that room, getting them in a place where they can build something or create something, that's going to give them a sense of accomplishment. In her course, she kind of talks about like she gives them laundry and she has them just start folding clothes. She gives this to someone who had been like a mother of like 5 kids or something like that. So definitely like appropriate for that person. You want to make sure the activity you give to them is appropriate, but the whole goal here is just give them something to do. And it's not going to work with everybody. I tried this recently with a patient that was kind of angry and grumpy and agitated. I tried over and over to give him something to do, and he would just refuse everything. And then one day he finally snapped out of it and he finally like participated. Sometimes you just have to be patient with them because it's not going to be working for everyone. All right, and then the last thing I'm just going to mention is just like memory aids or memory books. So you could have their family come in, bring in some pictures from home, have them make a scrapbook. You could have the patient make a scrapbook. You could just bring in memory books from home and just have them look over those like photo books. That can be a huge resource for these patients, and just to have those memories, that's going to be something that they're going to want to hold on to and keep close to them, because a lot of times they don't have anything else, and that's just something that's going to kind of bring them some like joy just to have that kind of next to them. It's kind of like a safety net. Just if you want to bring them into like a safe atmosphere, or help them to feel more comfortable and safe where they're at, having some sort of memory aid like a photo book is going to be really helpful. And then also, I'm starting a memory journal. So just you pretty much give the patient a journal or like a notebook. Anytime somebody comes in the room or anytime they do something, you have them record it in their memory journal. And this just kind of helps them so they don't get forgetful throughout the day, and so that they always like know kind of what's going on, and helps them kind of feel safe with the atmosphere when they're around you. And when, because sometimes it's scary for these patients when like somebody comes in, they don't recognize them, they don't remember that they worked with them the previous day. You can have them like look back, oh, we did this yesterday, let's look at your memory journal, remember we did this. And that will kind of bring that back to their memory a little bit and be a little bit more helpful. So I don't know, this course was like really insightful for me. I definitely took a lot from it. I'm definitely going to change my approach to treating dementia patients. So I hope this video was helpful a little bit. If you are interested, definitely check out my code OTFocus for MedBridge. It's going to give you a huge discount on all of the courses there. And if you are interested on treatment approaches or helping your patients with cognition, definitely subscribe for more.